Ladies and gentlemen, esteemed guests, dear colleagues, we're delighted to welcome and to count among us today the Minister of Health of Myanmar, Min Twe. Many thanks for joining us, Minister. Good afternoon, everyone, and a warm welcome to a very special day of health-related events here in New York City during UN General Assembly Week. Welcome to the Devex UHC Pavilion. My name's Richard Jones, Editorial Director at Devex, and we're the media platform for the global development community. Together with our co-host Essilor, we're delighted to welcome our audience here in person and our viewers across the globe joining us on live stream for this event, Seeing the Road to UHC, Eliminating Poor Vision in a Generation. For anyone tweeting today, well, first of all, hope you'll be nice. And secondly, encourage you to tag at Devex, at Essilor, at Sea Change for All. And if that's not enough, the hashtags UHC Pavilion and Put Vision First. Now at Devex, UHC is an issue that we followed very closely this year in our digital content series, Healthy Access, which has covered a lot of ground from access to primary care, to advocacy, funding, PPPs, digital tech, and more. And I definitely encourage you to take a moment to visit the photo wall here at the venue for more stories and perspectives from the ground. So here we are, a day after the high-level meeting on UHC and 2 days before the high-level dialogue on financing for development. This is a unique moment to engage in a conversation about the role of vision as part of this UHC agenda and the need for financing and to increase financing and support for elimination efforts. Universal health coverage. That means that everyone, everywhere, can access high-quality, affordable healthcare. It's a goal that binds us together, the entire global development and global health community. It underpins so many of the issues that we're working on, whether it's disease elimination or equality or economic development. So just how does good vision fit in? Well, it's estimated that more than 2 billion people globally have poor vision, and most don't have access to basic eye care services such as glasses and basic refraction tests. Poor vision also significantly affects the global economy, with an estimated $244 billion being lost each year because of a lack of productivity associated with eyesight. Improved vision means individuals have better opportunities to attain education, access work, and ultimately live better lives. And for women, who are more prone to vision health issues and face more barriers accessing services, ensuring good vision for all is also an opportunity to promote equal access to services for all. With these goals in mind, Essilor commissioned McKinsey & Company to investigate what it'll take to eliminate uncorrected refractive error by 2050. The report, launching today, many of you have it in front of you, together with a one-pager, is entitled Eliminating Poor Vision in a Generation. And it's a call to action. It's a call to action on what actions and investments are needed to raise awareness about poor vision, inspire a systems change, and ultimately make good vision accessible for all. So I'd encourage you to all take away a copy of that report or download a digital copy using the QR code. So today, on the back of this report launch, I'm hopeful that we can highlight some key findings on the role of access, partnerships, awareness raising, and cross-sector collaboration, a common theme that we've heard here today at UHC Pavilion. There's a lot to get through, so without further ado, please join me in welcoming to the stage Hubert Sagnières, Executive Vice Chairman, Essilor-Luxottica, and Chairman, Essilor. Hubert.
Thank you, all of you. Thank you, Richard. Can you hear me well?
Yep. Yeah, we can hear.
Great.
So, Hubert, many thanks for joining us.
My pleasure.
just wanted to set the scene with you on the scale of this vision crisis globally, and why for you, why for EssilorLuxottica, it's so important to establish uncorrected poor vision as a genuine public health issue, particularly this week of all weeks.
Yeah, specifically, I think you set the tone very well. We are, all of us, very close in actually year 2020, and still having on Earth 2.5, 2.6 billion people who can't enjoy their life because they don't see well. We can't support it. It's unbearable, actually. Specifically at the time where any type of news, any type of little news somewhere in the world, it's related in all the social media everywhere. The fact that today 2.6 billion people can't enjoy a good vision because they don't actually correct their vision, they don't have access to this, is something we can't accept anymore. So many years ago in all the industry, for years and years, we have been doing a lot of charity work, providing free eyewear in many, many countries around the world. But one day, we had an epiphany, and we said, only charity can't do the job. We have to mobilize around one purpose, around one cause, which is not a dream, but really something achievable. And this is what we want to talk with you today, which is eradicating poor vision from the world in one generation. And this is actually what we're embracing here today, and all of you, all of us, we're here to actually do today.
And I mean, you mentioned access there, Hubert. It's also about awareness specifically, isn't it?
Yeah, it's both. Actually, when you start peeling the onion and see behind the fact of, God, 2.6 billion people can't have access to good vision today. What are the reasons? This is the first question you ask. Specifically when you know that eyeglasses exist at any price, at any cost in many countries. So the solutions are there. So what's preventing the world of really having everyone on Earth being well? It's accessibility and awareness.
And you mentioned the epiphany moment as a company. Perhaps you could share with our audience a little bit more about your experience of intentionally pivoting towards being a purpose-driven company, how you managed the reorganization, for example, and how you might hope to inspire other companies to have this moment of epiphany in their own business models.
Well, I think when you're managing your family or your department or your division or a big company, at a certain point of time, you connect the dots, really. And this is what happened to actually a lot of us many years ago. Like some of us in this room, we are doing some charity work, providing eyeglasses in Latin America, in Asia and so on, having an immediate impact on the life of someone. Because this is what's outstanding when you, for the first time, deliver the first eyeglasses to a young girl, an adult. For the first time, you see the impact. It reminds me of a story when I was in Latin America with a little girl, giving her the first eyeglasses. She looked at the trees above her and she says, there are leaves in the tree. I didn't know there are leaves in the tree. Of course. A massive green mass, you see? So again, we are doing all this in the optical industry, as we say. And it is about impact. But, you know, we knew that it was not enough. We knew that by doing only those vision camps in many countries, we will never reach the world. And to reach the world, you need to have a strong purpose. You need to have a leading force with a very well-defined objective, that it is reachable. Everyone reaching actually or joining the force being credible in what they do. We are not in lip service here. We are talking human being and improving their life with an immediate impact by giving them eyeglasses.
And so how are you communicating this impact? How are you inspiring a workforce to sort of row in the same direction? And how are you overcoming obstacles as they appear in practice at Essilor Luxottica?
So, I mean, few words on this, maybe on Essilor Luxottica. We are step by step organizing the company with our purpose. The purpose drives the strategy and not the opposite. We have long debates with some key financial people here in New York. No, but really the purpose of what you want to do is driving the strategy and not the opposite. And once you have that, this is your only focus. And you organize your team in such a way. So within the Essilor Luxottica, step by step, in every country, we define our purpose, eradicating provision in 30 years, defining the strategy, and we actually organize the company in three types of, call it business unit. On one side, the very traditional one, selling eyeglasses in traditional stores, and it's extremely important. On the other side of the spectrum, purely charity. You will see in the report, even if we do all this, there will be always a kind of pool of 600 to 700 million people. They will not be able to spend 50 cents for eyeglasses. So we have to reach them through charity. But in between, you have a growing number of 2.6 billion people that could have access to good vision only by social impact business model. So three types of business model: the very traditional one, the charity or strategic giving, and the social impact business in the middle. And step by step, you will see the organization, country by country, is organizing itself through those three business models.
On these business models, what sort of key lessons have you learned along this pathway? And what would you say to inspire the next generation of business really transforming development in this way?
I really think that any company could have a purpose and should drive its strategy with its purpose. In our case, I don't want to say it was easy. It was obvious, not that easy. It was obvious because with eyeglasses, you have right away an impact in 1 second when you put those eyeglasses in the nose of someone in need. But that purpose, man, has to be found within any company of the world. And then you're driving all your teams internally, but outside, gathering forces, gathering energy with really that purpose in mind, driving any decisions. You could explain anything you're doing in your day life, in any type of activities, following the purpose for what you are doing and why you are here. And believe me, when you are able to articulate all this, then you gather forces inside your company, but you gather forces outside following your ambition of, in our case, eradicating pollution from the world. We know we can do it because it's achievable and we are credible doing that and we have the energy of doing it.
And well, as you just mentioned, and as mentioned earlier, today you're launching a new report which sets out a roadmap to eliminate poor vision. Perhaps we could just look back to the genesis of the project. What was the main reason and driving force behind this report from the outset?
But again, it's a journey. When after many, many years doing some charity works, we decided to move into social business impact model. We had plenty of failures. We learned from our mistakes. We have now identified 2 or 3 key business model, social impact that actually are successful. And then we are measuring the impact on the human being, on the people, on their communities, on the world, on the economy. And at a certain point of time, this is so obvious that you want to tell the world, what are your dreams? What are your goals? What is your purpose? When you know you have the solutions, when you know that you know how to do that, then you need to work on the first thing, which is the awareness. I have met so many people actually telling me, I didn't know. My kid is amblyops. My kid, he has a lazy eye. I didn't know it could be corrected at 2 or 3 years old. I don't want that to happen anymore. I want people to pay attention to their eyes. I want the mother, the dad, the grandmother, the relatives, pay attention to the eyes of everyone. And then step by step, we can solve all this. So when we met, my friends from McKinsey, working for us on this project, they were the obvious partner actually to put that in writing, measure it, and this is a report we have today that we think will have impact on accelerating the awareness of our purpose.
And yeah, and again, would encourage everyone to take a copy home. Time is short. I wanted to ask you finally, as I'll be asking all of our speakers today, for a final call to action here in UN General Assembly Week for our audience and viewers across the globe. How do we push the needle on progress? How do we ensure sustained progress on good vision? What is one thing that you would like the audience to take with them today and to power through the end of the week here in New York?
We work on accessibility, you work on awareness. All of you, each of you, you have to work on the awareness. So tweet, Instagram, Facebook, you're the expert of all that. I hope I will have 10 million clicks or tweets in the past 15 minutes we have been talking on this.
It's ambitious, Hubert, but
I know it is ambitious, but you don't drive any project with a low ambition. I think this is really the takeaway. I mean, communicate, explain. It's for yourself. It's for your family, for your grandmother, for the kids, for your neighbors. It's for everyone. Everyone on earth should be able to see well. And I don't know how old you are, but in 2050, I will be 95. I want to be there and make sure that everyone will see well on earth. And each of you, it is day one. It is day one in this journey. Join us.
Thank you, Hubert. Round of applause. Thank you, Hubert. A strong note to end on there, and many thanks to Hubert for his perspectives. At this point, I'd like to welcome a very special guest for some very short remarks before we move on to our panel session. Could I invite Dr. Ugen Dofu, Secretary of the Ministry of Health, Bhutan, who I believe is sat over here, to say a word, if we can get a microphone over to Dr. Dofu, to say a few words on how improved sight is set to impact health, wealth, and happiness in that country. Of course, with reference there to the happiness index, Bhutan's role at the top of the pile for many years.
Maybe first I should talk a little bit about Bhutan, because many people may not know from where Bhutan is in the map. It is a small mountainous country between two giants, China in the north and surrounded on three sides, south, east, and west by India, and two most populous countries. Bhutan's developmental philosophy is gross national happiness. Our health system is based on three-tier primary healthcare system as based on Alma-Ata and Astana declaration. We have reached about 94% of our population with our primary healthcare system, but refractive errors and vision is still a major problem in Bhutan because it is a mountainous country, especially far and remote parts of the country. People still, as the CEO of Isilur has said, our people still cannot afford spectacles, or also the health ministry not able to reach the population for checking of refractive errors. And Isilur has been kind enough to come forward and support Bhutan and make Bhutan the first country in the world to eliminate poor vision. So we thank Isilur for supporting Bhutan.
I'm now delighted to welcome to our stage our panel of distinguished champions of the Vision for All movement, who can share some unique perspectives on how to drive change for people and communities. So if you'd like to join me on the stage as I call you up, Jayanth Buvaragan, Chief Mission Officer of Essilor Luxottica and Essilor SAS. Welcome, Jayanth. Nick Martin, Deputy CEO of the Fred Hollows Foundation. Professor Serge Reznikov, international expert on eye health and former senior policy advisor and coordinator at the World Health Organization. Aliala Nandakumar, chief economist at the Office of the Global AIDS Coordinator and former chief economist for Global Health USAID. And Liz Smith, founder and chief executive at iLiance. Ladies and gentlemen, a round of applause for your panelists, please. So welcome, everyone. Jayanth, first to you. I think one of the most striking figures in this report is that we'll collectively need to mobilize some $14 billion to create a world free from uncorrected refractive errors. Can you give us a little bit more insight into these report findings, particularly in terms of things discussed in the report, issues such as access, affordability, awareness raising, and give us a little sense of where investment is really needed most?
Thank you very much, Richard. First of all, I just wanted to set the context once again that we really have a big vision crisis in the world, and it's time the world accepts and tries to address it. We've heard that 2.7 billion people suffer from uncorrected poor vision, and we don't need to invest money in inventing a new vaccine or a new molecule to solve the problem. The solution exists. Simple pair of spectacles, and we know that these spectacles are today available at the right price and to reach everyone. We've heard that you need to work on access and awareness. So as Hubert said, we had this dream to eliminate poor vision by 2050 because it's a no-brainer. You've got the solution, you know the problem, and it's just a question of connecting the dots. That's when we worked on this report as to what will it take for the world to eradicate or eliminate poor vision by 2050. So when we put a financial number to it, that's when the 14 billion number came up. Now, 14 billion over a span of 33 years, we're talking about less than $500 million a year to solve a problem which can actually give you $272 billion every year in increased productivity. For all of us in business, it's a no-brainer. The return on investment is stupendous. It's in multiples of hundreds in terms of what you put in and what you get out. Side of the economic impact, there's a huge social impact as well. When you see children falling in grades and falling out of school and falling into bad habits just because they can't see a white board or a black board. When you see people driving badly because they can't see the road and they get a driving license and causing many accidents and causing injuries both to themselves and to others. And I can give you numerous examples. It's really a no-brainer, the world should sit up and address. So that's when the 14 billion figure came up. I'm very happy that this report today kind of sets a roadmap or a blueprint toward what needs to be done to reach this objective. I know this number can be debated. People can say it's low, it's high, or whatever, but it's still directionally there, and it's something where we have to get to in the next 35 years. Now, when you see in terms of the total health spending, this is a very small fraction, especially for refractive error. Now, in that, the way we have looked at it is that there needs to be spent on different items, broadly 4 different pools. We believe that 90% of the problem can be solved by sustainable access or sustainable infrastructure. And what we need to spend as a world on this building sustainable infrastructure is about 2.4 billion, which is like 15% of the total 14 billion. We also feel that this amount of money, close to $1 billion, has to be spent on innovation, and this innovation has to be front-loaded. Innovation not just on products, but innovation on delivering refractive eye examinations, especially in far-flung areas, innovation in business models, etc. So that's something which needs to be spent. And then, most importantly, Hubert talked about awareness, and awareness is a big piece. And what is estimated is that anything between 4.5 to 5 billion needs to be spent on awareness creation, not only with the end users, but also with the policymakers, the governments, to actually make them aware of the problem, to give them compelling data, to help them to take informed decisions in the field of eye care. And finally, as responsible citizens of the world, we cannot turn our back to people who actually need these glasses and who can't afford to buy them. That's the most expensive part. That's about 6.5 billion. So give or take, between these four buckets, we do have a kind of a prescription, if I can use an eye care parlance, to solve this problem. So we know the problem. We have a prescription. We just need to go and implement it.
No, that's great. Thanks, Jayant. And maybe you could give us a little bit more about some of the efforts, some of the partnerships that you're forging at EssilorLuxottica, and perhaps give us a sense of some of the good results that have really been advancing your efforts as a company to eradicate poor vision. Echoing a question that I posed to Hubert as well, really, what can people in the room representing all stripes in our global development community, from private to public sectors, what can they really take with them this week? What is your key message as a representative of a private sector firm in this specific sector?
Yeah, I mean, as the industry leader, we do take responsibility for eliminating poor vision. But we also know very well that this is not something which we can do alone, and we will not do it alone. We know that we have to work with partners coming across within the industry as well as outside the industries, which includes governments, non-governmental organizations, big and small NGOs, the foundations, the multilateral agencies, and everyone. Today, we work with about 600 odd partners, but I think this number has to be multiplied probably 100 times more, because we need to work collectively, and it's only collective action that can actually create the impact. It's not about individual glory of one company or one person, it's about the cause, and we are very conscious about that, and we believe strongly in coalition building and partnerships.
So I expect a queue of people queuing up to talk to Jayant and Hubert after today's event, looking for that next big partnership to really move the needle on progress.
We'd absolutely love to do that, and we'd love to work with each one of you in terms of bringing good vision to wherever you can help us to bring good vision. Thank you.
Jayant, thanks very much. Perhaps I could move to Professor Serge Reznikov. Serge, in terms of setting the scene, taking a step back for a moment, putting the issue in context, just how crucial is ensuring good sight to really ensuring also healthy economies and prosperous communities and populations?
Thank you, Richard. Can you hear me?
Yeah. We can. I think we're in competition with the
Thank you. I mean, taking a step back, if I take a 150-year step back, when I was a young ophthalmologist working in Africa, I was there to do cataract surgery mainly. And I was shocked because actually most of my patients could not see, not because of cataract, but because of incorrect refractive errors. I was at that time the only ophthalmologist of a country of 12 million people. So it's a big base of patients. And if somebody would need a pair of glasses, for example, just for reading or for working in an office, that person would need to travel to the next country. So that was about 150 years back. And at that time, trachoma was considered as being the main cause of blindness in the world, and it was probably the case. Trachoma now is almost gone everywhere. We are in the last mile. Huge progress has been made. 10 or 15 years back, people would say, well, we'll never manage to eliminate glaucoma by the year 2020, and we're almost there. Which means that a lot actually can be achieved in a couple of decades. And what I take out of that is that there are a couple of things I think that are really critical. First one is working together, is to avoid fragmentation. It's using the same framework, an agreed strategy, so that partners join because they feel comfortable in joining. They're not joining a mess. They're joining a group of people who know exactly what they're doing. The second that's been very important as well is that it was always data and evidence driven. So particularly when we talk to the governments, it makes a big difference. Third, industry joined. And that was a major, major change in the game, because suddenly some solutions became available. Although it was not only about antibiotic, but the fact that the antibiotic was available was making a big difference, including for surgery, including for the promotion of hygiene. So my point here is that bringing the industry is something that is an extremely important component. And I think we have learned now, particularly in the broader non-communicable disease, in the broader neglected tropical disease area, that working with industry is absolutely possible, including for WHO. And what I would like to see is something similar happening, because we know it's a very big problem that is affecting the lives of billions of people. We know that there is a solution, but we need to get together and we need to have an agreed strategy.
Serge, in that quest for an agreed strategy, how can we really push on towards last mile activities and really ensure that there is, as the key word says, a universal approach to vision?
This is actually probably one of the main challenges, because we know that in order to achieve results, a vertical approach, very focused, very specific, is actually what is working. But we also know that we need to find a way of creating the interface with the rest of the health system. We need to make sure that whoever is diagnosed with another condition than refractive error has actually access to the appropriate eye care. But what I understand is that in the strategy that's been outlined here, this is the very specific part for the provision of the correction of refractive errors, but it is in the context, in the framework of the universal health coverage. And I think it's not randomly that we're here in the framework of the debate on the universal health coverage. I think it's really very, very timely and extremely strategic.
And in terms of the success that the eye health sector has seen in eliminating things like trachoma, I just wondered, is it about better data? Is it awareness raising? Is it other factors? What's your sense of why we are actually seeing progress in this area?
Well, I think that, data and just recognizing that a problem is actually a public health problem is absolutely critical. And we need to keep in mind that 15 years back, just because of the definition, incorrect refractive errors were not considered as an impairment. It was because the definition for visual impairment was with best corrected visual acuity, implying or assuming that everyone has access to glasses. And it has taken a lot of efforts to a small group of people, led by the late Professor Brian Holden, and supported by WHO at that time, to make sure that the appropriate way of measuring the magnitude of the problem is there. And I think this is absolutely critical.
Serge, thanks very much. Nick, perhaps moving to you, according to the report released today, awareness raising mentioned earlier has the second highest price tag of some $4.5 billion needed over the next 30 years. Is this surprising? Can you talk to your experience of why awareness raising is so critical and why that 4.5 billion really needs to be found?
Yes, well, first of all, let's just reflect on how important this report is. Elimination in a generation is a big ambition, but it's the first time that we've had a concrete roadmap for all the elements to address refractive error before the global community. And really, the missing piece of the puzzle in lots of ways is the public awareness piece. We've often known the costs around service delivery, what the training needs are around workforce, but really public awareness has been one of the missing pieces, the missing piece of the puzzle in how we address this critical global issue. And the report in quantifying it at 4.5 billion, obviously in the global context, that's not a large amount. And really, it comes down to addressing one of the fundamental barriers for people accessing service. We know that cost is one of the bigger barriers. We know that distance, rural, remote communities are the ones who are often without service, but general awareness is actually one of the biggest blockers. Too often when I'm travelling around the countries where we work, you're sitting there talking with an 80-year-old patient who's received a pair of glasses or a simple surgery, and it's, well, why didn't you access service before? And too often it's down to just, I didn't know. My parents were suffering from vision loss. Others in my community have it and they've gone untreated as well. So really addressing that public awareness aspect is one of the biggest parts of what we've got to do.
And I suppose it goes back to this last mile intervention that Serge just made. As a representative of an NGO, I just wondered what your take was on how to really ensure this sustained investment in awareness raising over a long time frame. How do we ensure that this doesn't drop off the radar?
Yeah, I think there's really critical roles for everyone to play in this. Obviously, NGOs have a really big role to play in it. They will always play a critical part, particularly in the underserviced, most marginalised communities. But NGOs from the international level supporting and building capacity for local NGOs to actually raise awareness at community level is so important. The private sector has a big role to play, not just those involved in the vision space like Essilor, but also the private sector involved as employers, people providing vision tests and awareness raising in the workplace in developing countries, also important. But really, to get to sustainability at its core, we need government buy-in, and that's integration of eye health into the health system of every country around the world, including developing countries. And at that point, I think we'll really see a breakthrough in the way it's delivered at primary healthcare level.
And at the Fred Hollows Foundation, what are some of the standout good results that you've seen on eliminating poor vision? I think many in the audience will be aware of your See Now campaign. What can we all learn from efforts like this one to take into a renewed push for good vision by 2050?
Yes, the See Now campaign in India was a really interesting example of how we can do things differently, and I think learn the lessons of public mobilisation and social mobilisation from other health causes, but in some ways also leapfrog a little further ahead. So using the star power of Amitabh Bachchan, who might be known to many people, a very large megastar from Bollywood in India, we were able to reach millions of people in Uttar Pradesh with a targeted campaign with a very, very simple message, just to get your eyes checked. And, really we were using some really creative and new things through that campaign, not just the power of celebrity, but also digital technology, social media, WhatsApp messaging, using the power of the smartphone that so many people now have in their hands in developing countries. And, with that campaign, we saw a 37% lift in attendance at eye health services.
But it was also the low-tech, the billboards, the flyers, the handouts.
Absolutely. So leapfrogging, but also learning all the lessons of what's been done well before.
Great, thanks, Nick. Moving to Nanda, Alianda Nanda Kumar. Nanda, as a health economist, a former executive at USAID, can you share your thoughts on how big an impact eliminating poor vision would have on the role of government for funding?
Clearly, the report The report clearly states that there's a huge economic impact. But I think there are a couple of things we need to keep in mind. The first thing is that the countries that are having the fastest economic growth are also the countries where you have the highest burden of uncorrected refractive error. So these countries have the ability and the fiscal space to deal with this problem. But uncorrected refractive error is, in economics, we call it a merit good, which means that there is a benefit to society, but there is also a tremendous benefit to the individual. So this is not what one would call a pure public good in that sense. So it's a very different creature and a very different animal from a health economics perspective. But one thing is very clear, right? There are 2 points I want to make. One is that this cannot be solved without the governments of countries, the private sector, the donors, but most importantly, the households getting involved in the solution, right? It has to be the households that have to be part of the solution. Without this coming together, it's not going to happen, and you need somebody at the country level who is going to champion this. Your Excellency, the Minister of Health from Myanmar is here. I don't want to put you on the spot, sir, but I have been in meetings with you, and I have seen you take executive decisions, and if you were to champion this, the problem will be solved in Myanmar, right? Thank you. The other thing to keep in mind is, listen, we're just having the UN General Assembly. They want hundreds of billions of dollars for climate change. The HIV people want hundreds of billions of dollars to eliminate HIV. So you just add this up, and there just will not be the money. And what I'm afraid of is, in all of this other noise, this should not get lost, right? So that calls for a very strategic partnership and a strategic approach to ensuring that eye care is front and center.
So does this mean that eye care has to be considered as a best buy, and that
Absolutely.
better advocacy efforts have to be made within government departments
Absolutely.
to ensure that...
Especially ministers of finance.
Any Minister of Finance in today? No, silence. So yeah, I think, Nanda, I just wanted to get your sense of how more funding can be attracted. Obviously, this is a competitive marketplace, the health sector. How it can be attracted to tackle poor vision. What's your ask of the international community, other donors, other actors, those involved in innovative financing, perhaps? What is the key to success here?
Absolutely. I think if you look at the donor space, especially in health, donor spending has kind of flattened out, right? Having said that, I think where donors are increasingly getting interested are on new business models, sustainable business models to address problems at the bottom of the pyramid. So if I were to put on a donor hat, I would think of 4 areas where I think there would be a lot of interest for donors, or donors should be playing. One is creating the enabling environment. There are lots of regulations and policies, right, at country by country level that should not hamper access to services and care. The second thing is, we are sitting at a UHC event, you have to make sure that eye care and uncorrected refractive error is explicitly part of the essential package of services in each and every country, right? The WHO has general guidance, but every country has the ability to decide what is included and what is not included. And this should be part of social health insurance, private health insurance, and government-funded programs. The third one, strategically, I think, is that you need to get into partnerships with other big initiatives. And I'll give you one example. The Office of the Global AIDS Coordinator, the PEPFAR program, has an initiative called DREAMS. It looks at adolescent youth and girls and how do you prevent them from becoming HIV positive. And one of our research studies showed that asset inequalities are one of the biggest factors that put these young girls at risk. So we have been in consultations to see whether the iMitra program can work with DREAMS to train these young women, right, so that they get a livelihood and we achieve 2 results, right? One is a sustained model to deliver eye care, but also preventing the spread of HIV. And the fourth thing is we're increasingly interested in blended finance and innovative finance interventions. And I'll give you just 2 examples. In India, USAID wanted to scale up private primary care networks, right? And one of our networks needed a credit line of $10 million. The traditional approach would have been to give a grant of $10 million. And we said we're not going to do that. For an investment of $35,000, right, we could underwrite the risk. The US government could underwrite the risk of a $10 million line of credit, right? So that is where we need to go. And similarly, a development impact bond, DIBs, we did the first DIB in Rajasthan around maternal health. What it helps us to do is leverage the power of the private sector, the private markets, to address big social problems. And this is a big social problem. And what one needs is a new way of addressing it, and all of domestic and all of market response. Thank you.
Thanks, Nanda. And Liz, at iAlliance, given your coalition's experience in countries such as Liberia and Botswana, I'd like to get your sense of how we can really move forward on creating some of these sustainable access points mentioned in the report released today. To what extent does sustainable access really hold the key to success here?
Yeah, it's absolutely critical. iAlliance is a coalition of multi-sector actors that include academics, NGOs, government, private sector, all coming together to close the gap in access to eyeglasses. And we've been at it for about 5 years now, and I think the most important thing to convey today is that now is the time to solve this problem. And as articulated in this wonderful report, we have the affordable product. We have proven models. We have scaling pathways. We have new technology coming down the pipeline, and we have this incredible corporate commitment from Essilor. And I think all of these things together really make us well positioned to solve this problem in its entirety once and for all. And so why am I so optimistic? So like I said, we have about 60 members, and what we've learned from these members is that there is strong alignment on what works. These members, this community of practice, they have pioneered models that can be scaled through government platforms, particularly school eye health, delivering glasses in schools, as well as delivering reading glasses through national community health worker programs. And similarly, we think there's an opportunity for inclusive optical to be the next off-grid solar. We could create a new impact industry comprised of investable sectors to create these new sustainable access points. And I think what's so exciting about this is that a finite amount of philanthropy and blended finance can unlock new resources to solve this problem at scale. And two examples of which are the government of Botswana and the government of Liberia. In addition to the incredible commitment of Bhutan, both these governments have committed to having the ministries of health and the ministries of education cover the costs associated with national level school eye health programs. So that's all children in public schools across the entire country, and the government, both of these governments have committed to covering these costs within the next 2 years. And I think that's a prime example of how philanthropy can come in and unlock new government resources.
And so how do we get replication here with other ministers of health? What is the advocacy ask in that sense?
I mean, I think the thing we can do the most, and I think this is, again, where the report comes in is such a critical piece of the story, is that we have a lot of the evidence. And I think what's important when you're making the case for solving this problem is to present the why it's important, all this impact that we have across children's lives, adults, productivity. But at the same time, we need to be presenting the how. How are we going to solve this? And so the impact in isolation without the how can only get us so far. And so I think that's where this report really, it's a game changer for us in terms of the kind of conversations we can have in terms of prioritization, in terms of investment and action.
And from your perspective, what is the key obstacle here, and how can it be overcome in practice? I mean, you've talked about access, partnership, more finance. Is the one silver bullet here, or is it just a range of different points that need to be addressed?
I mean, I think everyone on this panel has brought up the various barriers. I mean, awareness is a huge one. But I think when we're talking about making the case, I think we're really on the cusp of being able to solve this problem, particularly given around the momentum around the how to solve this. And I think we're really well positioned.
And finally, I wanted to ask you, obviously, we're one day after the high-level meeting on UHC. What's your sense of how we can better raise awareness about the importance of tackling poor vision and its link with universal health coverage, and really make sure moving forward as a room, as a community, that we ensure that vision and eye care has a place at the top table when it comes to UHC discussions?
Yeah, absolutely. So what we've learned during our 5-year tenure is again, it's pairing the why this is important with the how, but it's also, it's having a strong global strategy that's linked to country level success, and that these two things are very much intertwined, and that we need to be bringing all these things forward as we make the case.
Thanks, Liz. Jayant, perhaps a few follow-up reflections from you, if I may, having heard a lot from your fellow panelists about the need for innovation, for new models, for new partnerships, new financing models. DIBs were mentioned, which I know were covered in another event that we hosted this morning in association with MSD for Mothers. What are your reactions, and do you have the sense of that we're kind of on the cusp of a genuine generational change? How optimistic are you?
I'm very, very, very optimistic, especially looking at this August audience represented by the two governments from Myanmar and Bhutan, and all the people in the audience coming from different background, and the esteemed panel, all uniformly batting for eye care and eliminating poor vision by 2050 gives me a lot of energy, encouragement, and I feel extremely, extremely positive. So thank you very much for all that support. I just wanted to say a few words on the financing part. The 14 billion looks like a big ask, if you look at it as a number. But when you break it down over 33 years, it's not that big. And when you look at the amount of money we spend on healthcare in general or in various other things, it's a very tiny fraction. Now, there are already efforts which the industry is taking to raise this money. Some of you may be familiar with the Queen Elizabeth Diamond Jubilee Trust, which had successfully fought for trachoma and various other eye illnesses, has now adopted refractive error as one of its core programs. And they plan to set up a Vision Catalyst Fund and raise about $1 billion, which will help to start with the 53 Commonwealth countries and then other countries around the world. I think this is a great start, and then all of us are part of it, and we are supporting that initiative. Side of that, Nanda mentioned about the DIB, or the Development Impact Bond. I'm actually happy to announce to this audience that for the first time ever in the refractive error space, we should be in a position to launch a Development Impact Bond within the next 6 months. We have some of our banking colleagues here with us, and it'll be a bond with about $10 million to start with, and I hope that will set the trend to raise billions of dollars, because you can deliver impact, measure it, and then go back to investors and ask for more money. So financing is really not a problem. It's really the will to act. It's the collective action that we'll all put together and make this dream come true.
And a few words about this development impact bond, if I may. I'm not sure if you're in a position to give any more details to our audience, but just in terms of the process of setup, who you were talking to, how that was structured, partners that you've brought on board, could you give a sense of the genesis of that project and where you hope it will go?
Yeah, so we are still in the midst of structuring the product with the investors and the outcome payers. But essentially what we are trying to do is that we train primary healthcare eye care providers to give basic refractive error services. We're ring fencing the training, because training is something which is for public good, and training is something which helps society. And there are many investors and outcome payers interested in training young, unemployed and underemployed individuals to start their own micro enterprises. And it's in this concept that we are working, and we'll have more details in the months to come.
And for more on that, visit devex.com.
Absolutely.
Forthcoming reports. So at this point, I'd like to say thanks to the panel and take some perspectives and questions from the floor. I know that we have a number of eye care experts with us today, and I'd like to call on two in particular to kick us off. First to Nazila Vali. Nazila, where are you? Hello.
You're an expert.
So Nazila is Knowledge Management and Partnerships Lead at the Business Call to Action Initiative at UNDP, and not an eye care expert.
No.
Thanks for coming. Could you give us your thoughts on the role of business and how it can help innovate among communities, particularly at the base of the pyramid? Nazila.
Yes. I work for the Business Call to Action. We're a global initiative working to accelerate the contribution of the private sector to development. We're hosted by UNDP, and we have over 214 members across 70 countries, including SLR. And we're working with these members to try to accelerate their contribution, so depending on the needs and the challenges they're facing. What we do is really to try to help them understand that there's a real economic opportunity to tackle the base of the economy pyramid, whether as product and services or as part of the supply chain. Can I ask a question?
Yes,
Actually,
of
I had a
course.
question in mind. You've all touched on partnerships and the need to build coalitions and to really work collaboratively with both government and the civil society and the different actors, but including with the private sector. I'd love to hear more from, especially Giant, but also the other panelists, how to really build sustainable and impactful partnership. What are the key ingredients for these partnerships?
Who would like to talk to that, or should we go to Giant?
Partnerships, like I said, are extremely, extremely important. So there are different partnerships that we have. The first one is obviously with the governments of the world, and without whose support we can't solve this problem. And we've had some very successful partnerships, for instance, with the government of Bhutan and with some of the other state governments in India, in China, who actually have a dream to eradicate poverty in their own states and provinces, and these have been extremely successful. The second form of partnerships which we have done is building coalitions. And one of the successful coalitions that we have built together with the Brian Holden Vision Institute as founding partners is a program called Our Children's Vision. It's got 90 partners who are under the umbrella of Our Children's Vision. And we have a dream to reach 50 million children by 2020. And I must say this is one of the most powerful coalitions today. And they are already on track to reach the 50 million target by middle of next year. So these kind of collective action, all of us come behind one cause, which is children's vision, and work towards that. So there are other forms of partnerships as well, where we work with, on a local level, with the NGOs who deliver, and we support them either with products or with other kind of knowledge and technology which we can give them to help them be more efficient in service delivery. So in that sense, I think partnerships is the key. Like I said, probably at the beginning of my speech, that we work with about 600, probably we need to multiply it by 100 times more to reach the billions of people.
And perhaps we could get an NGO perspective, Liz or Nick. Do you want to jump in here on partnerships and the secret for success?
I'm happy to, and I think to address your question about how partnerships can work with the private sector, we have two relationships right now, and both of them are at the global level, and one is with Uber, and the other was with the International Labor Organization. And both of these institutions and organizations have recognized the impact, the importance of clear vision. Obviously, in terms of Uber, this is around a safety issue. If their drivers can't see clearly, they're not going to be safe on the roads. And so they've taken an initiative to do country by country, but it's a global effort to partner with some of our members on the ground, the NGO partners on the ground, to do screenings of their drivers, right? And with the ILO, similarly, there's been work done around the impact on increased productivity when vision is corrected with a pair of glasses. And it's very intuitive. And similarly, they've seen a value in connecting there are programs at the country level. I just came back from Cambodia, where I spoke to a room full of 50 factory owners who were there to say, yes, we want to invest in screening our workers. We want to make sure they have access to eyeglasses. And so I think it's just a matter of understanding how these partnerships can be mutually beneficial, because again, clear vision impacts so many different industries. And so these are two companies that have, or two organizations that have recognized the value of bringing clear vision to their drivers and to their workers.
Thanks, Liz. And Nick, did you want to jump in?
Yeah, I'll just very quickly add to that. I think, too often when we talk about UHC like we are today, we very easily talk about the role of the public sector. And in eye health, we're really unique in having a genuine tripartite arrangement with NGOs, the private sector and the public sector, all having a really strong role already in the delivery of services. And that becomes really important when we also start to talk about delivery of the SDGs and unlocking productivity and ensuring that vision's there for people to be involved in their ordinary working lives and community. One of the key partnerships that we've recently built is actually with the garment industry in Bangladesh. And when you think about it, it's a largely feminized industry. People are dependent on their vision for their work. And we're able to work with a cross-section of different players there to ensure that free vision screening and the provision of glasses were available there at the factory level. And that's a critical way that people beyond just the vision space can be involved in addressing this issue with a spirit of partnership underpinning it.
Thanks, Nick. And hopefully that answered your question, Nazila. Secondly, maybe we could turn to Dr. Christine Melton. Dr. Melton, President at the Aravind Eye Hospital Foundation. I wondered, Dr. Melton, if you could give us just a few key insights from that hospital's innovative cross-funding approach to eliminating eye disease.
I'm sure most people here are aware of Aravind for its the Aravind model and how they've succeeded against huge odds. A lot of things come to mind when I think of some of their innovative, models with accessing care. The Vision Center model, which has, now I think we have about 79 vision centers that are a hub and spoke model around the base hospitals. But basically, Aravind's just ability to find solutions to problems is what I think most people will recognize. The other area in which Aravind has been challenged lately, they are in a big project in sub-Saharan Africa, the Hilton Cataract Project, the Access Project. And although they've kind of figured out the Asian situation and problems, this is a whole new scope of issues which they're becoming experts on and trying to mentor and capacity building there. And a lot of that is access issues as well, obviously.
And your perspective from hearing from the panel today, any particular questions that you wanted to pose?
Questions, so many questions.
Put you on the spot.
No, I can't think of one in specific, but thank you.
No problem at all. Perhaps Professor Reznikov, how familiar are you with this model? Have you encountered this model in your work in country, perhaps at your time at the World Health Organization?
I think the Aravind model has been something that has really transformed the provision of eye care, particularly in the poorest countries in the world. I mean, the whole concept has been put together by Dr. V, and showing that even with very, very low level of resources, you can provide first-class, top quality of care, even to the poorest population. Just by cross-subsidizing, making that the people who can pay a little bit more will pay for the people who cannot afford it all. And as you mentioned, it was all kind of initially only for India, and everybody or most of the people would say, oh, this can only work in India because India is very special. Then some people started even beyond Aravind group to be inspired by that and using the same kind of approach. And I think it is working now, actually, in many places, including in Latin America, for example. This whole idea that, I mean, at the local level, you can actually raise the funds in order to provide extremely high quality of care is something that is working. And this is kind of a bit special for eye care, I would say. And again, I think this is very relevant about what we're discussing.
Serge, thanks very much. I'd like to ensure that we have time to take a few questions from the audience. So raise your hands. We'll pass around a mic and make sure that we can get to as many as time allows. Perhaps just limit to brief statements or a couple of questions for reflection. Let's see how many we can get to. One at the back there. Thank you very much. If you could introduce yourself, tell the audience where you're from, and then go for it. Thank you.
My name is Lisa Park. I'm an ophthalmologist and a cataract surgeon. I'm faculty at Columbia University, and I also sit on the board of Vision Care, which is an international NGO based in Seoul, Korea, and here in New York. I'm so excited and delighted to hear everything that you've talked about today, and particularly this partnership and developing coalitions between the private and public sector and sort of the financial means of battling this problem. I come from academia, and it is an interesting thing to try to approach this from that side. And I'm just wondering what you think about what kind of partnerships can be developed at that level.
Okay, so a question about partnerships. Anyone want to chime in on partnerships? Or any other questions that we can get to? Yes, we've got two here.
Thanks.
Hello, sir.
I'm Imran Khan from Sightsavers, and I completely agree with most of the points that you guys raised. And I think there was a point made early on about how we're really good around the supply side. So we understand the training, we understand the infrastructure needs, but can you speak more around the demand side? I know there's a key element around awareness raising, but how do we actually get the communities to demand eyeglasses and also build those sustainable solutions there?
Who would like to jump in on demand side? Nick. Yeah, and then maybe we'll go to who would like to talk about partnerships.
Happy to talk about partnerships.
Great, thanks.
Great, so on demand, and I should have mentioned, of course, that See Now was a campaign we delivered in India, not only with Essilor, but also with Sightsavers India. So thanks for the question, Imran. But in terms of what we're doing that's maybe a bit different, I'll use the See Now example again, because what we were able to do there was to really link up our public awareness work with some very, very strong tactical work to drive demand directly to service. And that was, again, through using those digital channels, WhatsApp, social media, but connecting it through to a referral service. So actually taking people's details, using missed call services and things that are quite popular in marketing and social awareness campaigns to point people towards their immediate service delivery options. So using that bridge between community education and really driving demand, using new technology is, I think, a really important thing that we've got that's maybe a little bit different to offer up.
Creates demand. So, when you have an access point within a days of travel, then that creates demand. And I've seen some examples, not only in India, but also in Africa. There's a large foundation called One Side, which works on creating access around Africa. And their experience has been that the moment they set up vision centers and create the access for people to reach that vision center within a day, that automatically also drives demand. So it's a combination of both awareness and access.
Nanda.
I wanted to touch on 2 points. One was the role of academia and how can academia play an important role. I'm an academic myself, but I think one area where there are 2 areas where academia can play an important role. One is creating the evidence and rigorous evidence to show why this is a problem and what are the benefits. Right? The second one, of course, is a number of initiatives are going to be launched. Right? At some point, you need unbiased, systematic evaluation of what is working and what is not working. And I really feel this evaluation or the operations research is something that academia can contribute to. On the demand side, it's a very important point, right? So healthcare has been driven by supply-side economists. And we have really ignored the demand side. But if you look around, there are a couple of things that impact demand, right? One is, of course, ability to pay. The second thing is distance from access, point of access, right? There's well established. So the question is, how can you take care to the person and not the person to the care? And in maternal health and other areas, you've got a lot of very innovative demand side interventions, which I think we have not yet brought into the eye care world. So.
Thanks, Nanda. I'd like to take a short intervention from the Minister of Health of Myanmar, Min Tway, and then we'll move to the gentleman at the back. I know you had your hand raised for a while. Let's try and keep interventions short. We have 10 minutes left, and we'd like to wrap up on time. Thank you
very much. When you were discussing, I got a lot of information. But before I came to this meeting, I had a short chat with Lucas and Shan. You know, I look at my country. We may have a vision care crisis in my country. What I'm thinking of, as you have mentioned, we have to go first in school health. We have 9.7 children, school children. How many of them, they need refractive errors? Without knowing, they may be reading a one paragraph. Instead of 5 minutes, they may be reading 10 minutes. So they may not be able to read outside magazines or outside literature. So this has very negative effect on the educational system. So I would like first to come eyesight to have a quick review of how many refractive errors children need. On top of that, we have very few refractionists. Even these refractionists, if they are not up to the mark, they may be giving wrong, examination. And the eyeglass that they are going to prescribe may be wrong. So there are many things, I would like to go ahead as soon as possible to come, Lucas, as well as I discussed with Hubert, and also Jayanta, to come to my country, and we will think of how to start the program straight away in my country as soon as possible. Thank you very much. Yes.
Thank you, Minister. Gentleman at the back.
Hi, my name is John Barrows, International Eye Foundation. Two questions, actually. One is related to the creating this large number of new access points. Overall, this is incredible. This is in fact really fantastic, but creating all these new access points, that means also the new human resources have to be identified and developed. What are your thoughts about that? Because that is a big issue, especially in public sector in poor countries. And the second question is there access available to some of the reporting and the documentation and the studies that must have gone into this for a deeper dive later on beyond the report?
So first of all, maybe I can call on Liz to speak a little bit about access points and workforce needs.
Yeah, absolutely. So in terms of creating new access points, of course, absolutely, John. I mean, we need to be building a more robust professional base, more eye health professionals. I think that that's something that can be tackled primarily with philanthropy, but I know that we need to be encouraging governments and ministries of health to be actively involved with us in this process. I was on a call earlier today hearing about even once these eye health professionals are trained, if they're sent to a health facility without adequate equipment, inevitably they'll leave and go work in the urban communities. So this is something that this strategy has to be developed in tandem along with creating these new access points.
And Jayant, perhaps we could turn to you on the second point.
Yeah, I mean, also on the access and trained professionals, I can share with you our experience. We're talking about creating primary vision care providers. And so what we do is that we take young people from the villages and we train them with 2 months of intensive theoretical training and 10 months of practical training, and they pass a government certified examination, and then they go back and become micro entrepreneurs. Today we've got about 7,500 of them, and we plan to have, hundreds of thousands of them in the coming 20, 30 years. So it's doable. It's not a permanent solution. It's a primary vision care provider, but obviously then we give them lifelong learning and ways to actually keep on improving their skills and finally join the mainstream and have a pathway to connect with hospitals. So that's the plan, and we have evidence to prove that what we have done over the last 7, 8 years has created tremendous scale and impact, not just in one country, but actually in 6 or 7 countries. So that's been one of our experiences, and I believe that can be easily scaled up.
Thanks, Jayanth. And I think the time is short. So to mark the launch of today's report, and again, I'd encourage you all to take a copy home or to download the QR link for more info on some of the issues that we've touched on today. I'd like to call our photographer to the stage and ask that you, our esteemed panelists, join me on the side of the stage. And we're going to take what is called, or what I've been told is called, a Wi-Fi. So not a selfie, but a Wi-Fi, capturing this moment for posterity and spreading the word online on social media, maybe not the 10 million clicks that Hubert talked about earlier, but we're going to give it a go, that uncorrected poor vision is the world's largest unaddressed disability. Solving the problem of poor vision will create huge returns for the world, and that eliminating poor vision by 2050 is possible, but only if we all act now. So maybe I could invite our panelists and as many of the audience members who want to appear on our inaugural Wi-Fi on Devex.com to join me over here. And I'll say a few short words meantime of conclusion. Listen, $14 billion, it's an eminently achievable target, but only if partners pull together. They work shoulder to shoulder, and they do whatever is needed to get the job done across sectors by harnessing innovation and new finance that they need to get the job done. So what I want to ask everyone is to come over here and to join me in declaring 14 billion reasons why we should eliminate poor vision in a generation and help millions to see their own roads forward to UHC. So everyone who has a copy of the report, we're going to put hands in the air, thumbs up, wave the report around. So millions seeing their own roads forward towards UHC. So yeah, everyone together, 14 billion reasons. I'm just going to wrap that up. Thank you very much for doing that. Thank you. The Wi-Fi.